Hello everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I'll be talking about is there a link between type 2 diabetes and air pollution? So if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. To prevent or manage diabetes, your doctor has probably told you to pay attention to what you eat, exercise often, and understand your family's health history. But the quality of the air you breathe could also play a role in your risk for the diabetes or how well you are able to stabilize your blood sugar. Emerging studies are shedding light on the relationship between air pollution and diabetes. Wildfire smoke is one example of air pollution, and it's associated with an increase in the risk of health complications in people with diabetes. According to a study published in June 2020 in Environmental Health Perspective, and other research such as a review published in September 2020 in Gut Microbes, scientists have uncovered the surprising role that air pollution in cities can play in altering gut bacteria that increasing diabetes risk. Now the question is, can exposure to air pollution affect a person's risk of diabetes? The global toll of air pollution and diabetes is significant. According to a study published in July 2019 in the Lancet Planetary Health, an estimated 3.2 million cases of diabetes globally could be attributed to elevated air pollution in 2019, with increasing burden falling on people living in low and lower to middle income countries. It's only recently that air pollution has been considered as a factor contributing to greater risk for type 2 diabetes, says Tanya Aldred, PhD and assistant professor at the University of Colorado in Boulder, who studies the cause and consequence of type 2 diabetes. Dr. Aldred uncovered health disparities for Latino children living in urban Los Angeles from 2001 to 2012. She found that increased air pollution increased risk factors for type 2 diabetes, such as decreased insulin sensitivity and reduced production of insulin in overweight and obese children. Her findings were published in July 2019 in Diabetes. Now, why is pollution so bad? Pollution carries fine particles, including metal and other toxins, that inflame the lungs and other parts of the body. Some experts hypothesize that inflammation from fine particles in air pollution increases the risk of type 2 diabetes. Aldred suspect air pollution changes the gut in unhealthy ways, potentially contributing to type 2 diabetes. Young adults in Southern California with greater exposure to air pollution had less diverse gut microbiomes, according to one of her studies, which was published in May 2020 in Environmental International. The gut microbiome is a group of microorganisms, including bacteria, that help your body break down food and may protect against infection. Air pollution alone does not cause diabetes, caution Aldred. It's a constellation of risk factors that include poor diet, poor physical activity, and greater exposure to environmental toxins. She says air pollution can increase health risk for people with diabetes. People with diabetes need to be aware of their surroundings and the air quality, says Young. Smoke from wildfires is an increasing source of air pollution, according to a report published in November 2020 in the New England Journal of Medicine. Researchers have found people with diabetes may be negatively affected by smoke. In the previously mentioned study, researchers examined ambulance dispatch calls of roughly 5 lakh people over 5 fire seasons in British Columbia. These included severe fire season in 2010, 2014 and 2015, when more than 740,000 acres burned. Exposure to elevated level of fine particulate matter in smoke was associated with increased ambulance dispatches within 24 to 48 hours for episodes of high and low blood sugar, says Jiayu, PhD, who led the research while at the University of British Columbia School of Population and Public Health. She now works for the British Columbia Centre for Disease Control in Vancouver. Just the stress of having a fire nearby could increase blood glucose, says Young, a certified diabetes care and education specialist, adding that continued high blood glucose can produce extremely high level of ketones, leading to diabetic ketoacidosis, a serious and life-threatening complication that is more common in people with type 1 diabetes than those with type 2. Be prepared for emergencies like wildfire that can lower air quality. People with diabetes need to be aware of the potential impact from poor air quality events such as wildfire smoke and to have an action plan to reduce exposure. Young recommend that individual managing diabetes keep track of changes to blood sugar and call their diabetes care team with any questions. She recommend keeping a list of your provider's phone numbers handy for when questions arise. She says that paper on surgical masks, scarves, and bandanas will not protect your lung from the fine particle in wildfire smoke. A 9N95 respirator may help reduce the risk, but it must fit properly. So, ask your physician if you're considering purchasing one. So, practical tips for dealing with the air pollution if you have diabetes. Reducing exposure to air pollution is important for people with diabetes, says Young. Monitor air quality by visiting airnow.government. So, the US Air Quality Index, you find the latest information in your area. She says use app on your phone or tablet or watch the local news to keep tabs on air quality. Try to stay inside if it's a high pollution day, and it's recommended to stay indoors if you have a chronic condition. Don't go outside for your walk, says Young. Being inside more means paying attention to indoor air quality too. Make sure the filters on your HVAC system are clean, says Young. You can use in an air purifier or portable air cleaner designed for single areas of the home. Air cleaners won't remove all pollutant from the air, but they can help, says Young, who recommend checking out the US Environmental Protection Agency guide to air cleaner in the home. If the air quality is bad, don't do anything to stir up the air like vacuuming. So that's all about the diabetes in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. I'm definitely sure that will be going to help you in order to overcome your diabetes. So that's all. Before signing off, I would like to request you all, please do like, share, subscribe this video with your loved ones so that they will get to know better. So this is Carrie Anderson signing off. Please do take care of your health. We will definitely meet in the next video with another content. Till then, God bless you. Bye bye and take care.